We watch shows like Grey's Anatomy and movies that depict this toxic workplace environment within the hospital, and we hear stories about nurses eating their young. But in the radiology department, is it really this dramatic? I'll tell you. My experience comes from interactions that I've held within 8 different hospitals. In 2 of these hospitals, I was a student. 2 of the other hospitals, I worked full-time. I did a short stint in one of the hospitals, just like more of a training / I picked up shifts there. And the other hospitals I'm associated with as a clinical instructor, so I go and visit my students there. So the way that I'm going to speak about this is how we treat each other as a department, how other departments see us, and our interactions with the actual physicians. There can be a lot of different personalities within the X-ray department, and knowing how to manage those personalities and work with them is part of the job. However, if there is somebody that you just truly don't get along with, nothing says that you actually have to interact with them at all. It is of utmost importance that management is paying attention to the personalities that they are bringing in to the department and meshing with the personalities that are already there. If management is not paying attention to this and they are just trying to fill positions, then it can become a pretty hectic and not so friendly workspace to be in. Out of all of the hospitals that I've been at, only one site actually has this issue, and they can't seem to get it together. Every other site that I've been to has at least some positive rapport where they are able to work together in order to achieve a common goal for the patient. Something huge that I always tell people is that you don't have to be everybody's best friend. Of course, we want people to like us, but at the end of the day, you are there to do a job and then you get to go home. I think sometimes in healthcare, especially within our department, we have some downtime where our job and friendship relationships can be blurred, and that can cause some drama within the workplace. If you are a student coming into a radiology department to learn, you will most likely have a positive experience. I feel like our career field is very kind to our students, but of course, there's always going to be that tech that just doesn't do well with students, the tech that doesn't necessarily follow the rules, so they don't want students to be with them. So it's not that they don't like the student, it's just that they don't want that added responsibility on them. We want to see our students succeed. We need them to graduate and be good techs so that they can come work for us, because we are in need, always. Also, out of the 3 modalities between X-ray, MRI, and CT, CT is going to be the most dramatic. I feel like the personalities that gravitate towards CT are just a little bit more extra. It's no offense, but those personalities are a little more intense, and it's kind of a harder environment to fit into if you are not similar to them. MRI is definitely the most chill. If you want to be left alone for long periods at a time, MRI is the route to go. Once you're thinking of outside of the radiology department and all of the other people that we interact with on a daily basis, mostly nurses, we're kind of the stepchild of the hospital. We're not treated poorly, we're just not as respected. We don't necessarily have a whole lot of face-to-face interaction with the nurses and staff in other departments. We just get an order, it comes into our department in our hole, and then we go do that X-ray exam with the patient directly, and then we go back into our hole. And that's how we like it. If we do have to interact with a nurse, it's because something's wrong with the order that we need fixed, or we need more information, or we have bad news that we aren't able to do the X-ray for whatever reason and we need to come up with a different plan for them. Ideally, there's not going to be a lot of interaction, and they don't understand how difficult our job can be sometimes, just like we don't necessarily understand the capacity of everybody else's job. So in general, the mutual respect within alternative departments isn't really there. So if that's something that you care about and that's going to bother you, then it might not be for you. We do get a lot of appreciation and respect from our physicians and our radiologists. Unless you're in surgery, our physicians in the emergency department and the urgent care and outpatient facilities, whenever we call for a call result, our interactions with those doctors are in general very positive. You will get those doctors who are on their high horse, and although you've had years of experience in x-ray and you want to suggest to change the order in order to better demonstrate what they are trying to see, and they will shut you down and say, no, I ordered this, I want this. And then you're like, okay, that's what I'll go do then. Most of the time, those interactions are quite positive, and having the discussion of what to order and why, it can be a great learning experience for both the tech and the provider. If you don't know, the radiologist is actually the doctor who reads the x-rays, and they work directly with us radiographers. A lot of the radiologists that I've worked with do understand that some exams just don't go well, and it's not an easy task all the time to be able to get the images that they need. So even if they aren't frequently expressing their appreciation, it is there. And not saying that every radiologist is like an introvert or kind of odd, but it does take a certain personality to be able to work in a dark room all day, reading images by themselves. And we just have to keep that into consideration whenever we're communicating with them. Those of us who perform like CT exams or fluoroscopic exams in x-ray, we work directly alongside the radiologist. So we'll set everything up, we'll bring the patient in, we'll call them and say, hey, your patient's ready. The radiologist will come down, perform the exam. And although it's a slight interaction that they have with us, it's a time that you can begin building a rapport and have somewhat of a positive working relationship with them. Are you guys going to be best friends? Hopefully not, but you can create that positive interaction and that good working relationship without any drama. So quick recap, if management is doing a good job with their staffing, then everybody in the department will get along enough to do their jobs. And then if they don't get along, they still do their job, and then they just sit on their phone whenever they don't have anything else to do, which is very typical to see in the department. It's in general like a very chill environment. Outside of the department, there might be a disconnect between respect of our peers. They just don't quite appreciate what we bring to the table. That's their own problem, so it's not on you. As far as students go, radiographers, we will take you under our wing and show you the ropes. We want you to succeed. However, some of us don't enjoy working with students, and you can stay away from those people. And the others you might come into contact with, you just have to really focus on what they're saying and not how they're saying it, because that could just be their personality. Don't take offense to how they're relaying the information, just soak in the information itself. And lastly, our interactions with physicians are minimal, but typically they have a strong basis of respect and appreciation. So is healthcare a toxic workplace for radiographers? No, it doesn't have to be. There's one hospital out of the 8 that I've worked with or at that is a toxic environment. Unfortunately, it is because of staffing and management not reining in those personalities that are impacting others. So if you had any concerns about drama in the workplace before becoming a radiographer, don't be concerned. It's fine. It's not that big of a deal. You don't have to be everybody's friend. You just have to show up and do your job. But if you have any questions, please feel free to leave them in the comment below. I will get back to you eventually. As always, stay safe, have a great day, and I will see you guys in the next one. Bye.